Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's availability with Dr. Strang. Just before we start, Dr. Strang has some prepared notes and then we'll take questions from media in the room and then from media on the phone lines. Go ahead, Dr. Strang.
Thanks, Tina. Good afternoon, everybody, and thank you for joining for this update. So our case numbers continue to be low and stable in Nova Scotia, with cases being related to travel, and recently about 40% of our cases have been travel related, or in known close contacts of previous cases. We are not seeing COVID-19 circulating in the province at this time. The main COVID risk continues to be importation through people coming to or returning to Nova Scotia. And with a fourth wave of the highly infectious Delta variant happening or starting in other parts of the world and in other parts of Canada, we need to continue to take COVID very seriously, even as we're transitioning from an acute pandemic to living with COVID, or what we call an endemic state. It is too early to treat COVID completely the same as other respiratory viruses. And our best defense against COVID and the way we can live as openly as possible as we move into this endemic phase is to have everyone who can get fully vaccinated. Since we started vaccinating people in Nova Scotia, Nova Scotians have, by and large, done the right thing by coming forward and rolling up their sleeves. As of today, about 66% of Nova Scotians have received 2 doses of vaccine. We're at the top in Canada for vaccine coverage, but we are still not where we need to be. And it's important that we do not lose momentum now we are so close. In order for our province to further reduce restrictions and to move to phase 5, we need at least 75% of the population to be fully vaccinated. If everyone who is currently booked for a second dose takes their vaccine, we will have about 76% of the population vaccinated. But the challenge we have is that many of these appointments people have stretch into the fall. So I need to be blunt. Whether we have restrictions or not in September is fully in the hands of the Nova Scotians who are currently have an appointment booked but have not yet moved it up into August. There is enough vaccine in the province to immunize all eligible Nova Scotians now. To reach our goal, we need about 35,000 people to get their second shot in August. If they don't move their appointments up into August, restrictions may need to continue into September and beyond. So if you're eligible and are waiting to get your second dose, please take a minute and move your appointment up. Follow the directions on the rescheduling email you would have received, or call the toll-free vaccine booking line. It only takes a few minutes to reschedule, and there is plenty of vaccine appointments waiting for you across the province. I know that many individual pharmacy clinics are reaching out to patients by phone to move their appointments up. And provincially, we have sent out several reminder emails to people who have an appointment. We know that now in this last phase of our vaccine, our community clinics are seeing, and we expected this, a large decline in appointments. So over the next couple of weeks, these community clinics will close, and we will move to pharmacies being the main providers of vaccine. However, our central booking system, which is a hallmark of our quality program, will continue. Anyone who does not move their appointment up will soon receive an email canceling their original second dose appointment. And that's simply because if their appointment is at a community clinic, it will no longer be there. And even the demand in pharmacies is reducing. So there'll still be lots of access in community pharmacies, but it may not, every pharmacy may not always be open for vaccination. So because we have to rejig our whole vaccine program, people's appointments may well, certainly in community clinics will be canceled, and a pharmacy clinic may well be canceled. So if the people do receive a cancellation email, you will still be able to get your vaccine, but you will need to schedule a new appointment, and we're asking you to do that as soon as you can, and do that in August if at all possible. I am pleased to hear that yesterday we're still doing first doses of vaccine, and yesterday we had 1,300 Nova Scotians come forward for their first dose. So we're still getting people coming forward to start their vaccine series, and I want to thank those who continue to do that. It's important, as we need to get everyone who is eligible to get both first and second doses. So if you haven't started your vaccine series, it's not too late. Go get your first shot. Go to the vaccination site and book that appointment, and then you'll be booked as quickly as you can with an appropriate interval for your second dose as well. There's been a lot of questions about what phase 5 could look like. And as I've said before, once we reach phase 5, most or all of the restrictions, like gathering limits, and mandatory measures like physical distancing and masking, will be removed. However, I'll say it again, to do this safely, we need a high level of 2-dose vaccine coverage. What we see in other parts of the world where the Delta variant takes hold is where either there were no restrictions or restrictions have been moved, and there is still a large proportion of the population that is unimmunized. So we're not going to take that risk. As I said, to do this safely, we need this high level of 2-dose coverage. We've always taken a cautious approach in Nova Scotia, and will continue to do so. That has worked well for us for the last 18 months. People should be aware, though, that in phase 5, we will still be strongly encouraging and supporting, in many ways, general measures that prevent the spread of a range of illnesses. So things like staying home if you're acutely ill, increased hand washing, all other measures, increased cleaning of high-touch surfaces, all those things. And there'll be much more to come on that and how we communicate that. So while we'll be moving away from mandatory measures, we'll still be strongly recommending and supporting a range of these personal measures that aren't specific to COVID. And if we do them well and do them better, we'll prevent a whole range of things like influenza, gastrointestinal illnesses, and other respiratory viruses. But coming back to COVID, it's important that we reach our vaccine target as soon as possible. Not just to get the restrictions lifted, but to protect yourself, your family, and your neighbors. As I said earlier, we're seeing a rise in cases across the country and around the world due to the more infectious Delta variant, and a fourth wave is developing. We're also seeing restrictions in place in other jurisdictions for those who are not fully vaccinated. Travel is an example. So for those who are wondering whether they should get vaccinated, if nothing else, you need to know that the world will be smaller for those who are not vaccinated, as performances, cruises, travel, and many other sectors are starting to require full vaccination for participants. So the way forward in living with COVID is normally impossible is actually straightforward. It's to get vaccinated if you're eligible, and do it as soon as you can. Tina.
Thank you, Dr. Strang. Just a reminder, we'll take one question and one follow-up in the allotted time that we have. We'll start with Natasha Pace from CTV. Go ahead, Natasha.
Thank you. The Premier of Quebec just announced that the province was implementing a vaccine passport in that province, and I'm wondering whether or not that's something being looked at in Nova Scotia that you're aware of.
We're participating in some national conversations led by the federal government on that. There's a number of issues around that, what is your proof of vaccination? You need to have a robust, valid proof of vaccination, and there's lots of information. I just got sent a report today from a legal community around an international conversation around fraudulent vaccination claims. So it's not, you need to have a process that actually you can be reassured that it's a valid proof of vaccination. There's all sorts of legal, human rights, ethical issues around vaccine passports. I remain concerned that if not done very thoughtfully, something like a vaccine passport will further marginalize populations that are already marginalized in our communities. So there's a lot to think about, and we're participating in some of those conversations nationally. I will say that we continue in Nova Scotia, we continue to take an educative, cooperative approach. We feel that if we give people good information and make sure that they have really good access to vaccination, that really is the way forward, that the vast majority of people supporting them that way will get us where we need to go.
Go ahead, Natasha, with your follow-up.
Thank you. In terms of Nova Scotia, there are a lot of larger events started up. I know the Wanderers had their first game on Monday. There's a big concert announced at Scotiabank Centre today. Are you concerned at all that we might start to see an increase in cases where these large events are starting to happen now in the province? And is it possible that we could see a fourth wave here?
So there's a number of things in your question. First of all, those large events, if they're happening now, we've reviewed plans, for instance, for the Wanderers. They have to happen within the gathering limits that are allowed in Phase 4. When we move to Phase 5, whatever gathering limits are there, or maybe no gathering limits, whatever is in place, those events will still have to follow those. And we're working with Events Nova Scotia, Community Cultures and Heritage with that kind of entertainment sector. I think the way we can hold these safe, we come back to vaccination. If we continue to be careful at our borders, as I said, the risk is importation. If we continue right now, people coming in from the outside of Atlantic Canada, whether you need to quarantine or not is based on whether you're fully vaccinated or not. So if we continue to take that kind of approach, that you're welcome here without quarantine only if you're fully vaccinated, limiting the ability to import vaccine, as well as continuing to have the necessary things around surveillance, testing, all those pieces that allow us to detect anything if it does start to occur early, and still promoting, even though we may not require them, but still promoting things like masking, hand washing, those kind of pieces. I think we could have those large events safely, but it all depends on keeping our epidemiology low, having that highest possible two-dose coverage, which is the strongest defense. So even if the virus does get introduced, if the vast majority of the population is doubly vaccinated, the risk of having widespread of the vaccine is very limited. And then if you also add that on, people still practicing things like being careful about your close contacts, still masking in indoor crowded public places, all those kind of measures, those are the things we're looking at that will allow us to move into this living with COVID, but doing it in a safe manner.
Next, we'll go to Carolyn Ray from CBC. Go ahead, Carolyn.
Dr. Strang, we wondered if you could talk about your thoughts on the changes in Alberta and lifting the restrictions there, especially given that there are a number of rotational workers from Nova Scotia who go back and forth between the provinces.
First, we're fortunate that our rotation workers, by and large, are now, we know through our experience, are doubly vaccinated. So I'm not overly concerned around those rotational workers, and those who aren't still have quarantine restriction, modified quarantine if they come here. Every jurisdiction is going to make their decisions based on their assessment of what's appropriate. I'll come back to, we've always remained cautious in Nova Scotia. But I think the science is pretty clear that it is premature to say that the pandemic is over and we can treat COVID exactly the same as any other respiratory virus. So we will not be following the steps that Alberta has done.
Go ahead, Carolyn.
And we're seeing, as you say, the potential fourth wave in other jurisdictions, other provinces around the world. Do you have a threshold when Nova Scotia might, say, increase border restrictions again, or can we expect it to be at this stage for now until we reach stage 5?
We're working on that. Part of our transition plan is we're transitioning all our surveillance program, our public health measures, and based on how we follow up cases and contacts, and mostly based on vaccine status, our testing strategy. One of the things we're looking at is that as in this new phase 5 of living with COVID, being clear in our surveillance, what are the triggers and targets that would then make us look to say, what do we need to implement or re-implement to bring that under control as quickly as possible. We haven't decided exactly what all those targets are. That's a piece of work that's ongoing. But clearly, we need to maintain a surveillance system as we move into the fall. So we have a good handle on what, if any, is the level of COVID activity, what are the circumstances under which it's happening, and watch it carefully so we can intervene appropriately, but do it very early on and limit any potential spread.
Next, we'll go to Paul Bacon from allnovascotia.com. Go ahead, Paul.
We have done a better job at double dosing people, our eligible population, than New Brunswick or PEI have to date. People there don't have to wear masks. People here still do. Some Nova Scotians find that puzzling. What would you say to them?
So I think it's all about our cautious approach. I get it. It's been a long journey in the summer and people wearing masks. However, we use these multiple layers. We have our border measures, we have a growing vaccine coverage, but it's not at the level where it needs to be because the Delta variant, you only get good protection with 2 doses of vaccine, and it is highly infectious. So you need really strong measures in place. And so we need things like, we know that masking works. So we've removed masking in outdoor places because we know outdoors is much lower risk. But indoors, especially when we have large numbers of people, there is still a risk. If somebody came in now with infectious with the Delta variant and wasn't following their quarantine, for instance, we still have too many Nova Scotians who are not protected because they're not yet fully vaccinated. And so continuing to have masking is another layer that will help prevent any spread while we build the highest possible level of 2-dose coverage. It's about being cautious and having a safe, multi-layered approach, and that we can only move away from that once we get enough people with 2 doses of vaccine.
Go ahead, Paul, with your follow-up.
It seems like there is a core of Nova Scotians who just don't want to get vaccinated. What would you say to them?
I mean, the core in any, the true is a small number, a small percentage. We're getting close to our first dose coverage. We base things on we've hit our minimum of 75. We're every day we're building more, and we're getting close to having 80% of the population with a first dose of vaccine. When you translate that through to the percentage of who's eligible, who can get the vaccine, that'll be 90%. So we're left with the 10%. And I think any vaccine program, if you get 90% coverage, you're doing extremely well. And it's very hard to get much beyond that. And I think we'll get there with our second dose coverage as well. And we know from all the modeling, all the science, that you need a very high level of coverage, but you don't need 100%.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Dr. Strang, in my conversations with people, the largest, most serious worry and anxiety is around children under 12. Your office or the public health or the health department has been very good about providing information in terms of ages and vaccination status without, giving away personal detail. Can we start getting data for those under 12? Right now it's just under 19, and because we know everyone under 12 is not vaccinated. There were 2 cases, for instance, on Tuesday that were under 19. We have no idea if they were under 12 or if they were 12 to 19 who were vaccinated.
I'll take that back to my surveillance team and get that further breakdown. That's absolutely legitimate point.
For follow-up, I think you've been kind of addressing it, but is there going to be, do I hear you saying that there's going to be like a phase 4.5 or a phase 6 or intermediate phase where we've done away with most restrictions except travel, the quarantine requirement for travelers? Is that a mid-step, or what does that look like?
I think it's a recognition of that, and no final decisions have been made. But one of the things we're looking at is as we move into the phase 5, which is lifting all the mandatory measures and restrictions, given what's happening in other parts of Canada and the world, the question we're asking ourselves is, do we need to maintain some level of border restrictions that would essentially maintaining what we currently have? which would be you're welcome to come to Nova Scotia, and you don't have to quarantine if you have 2 doses of vaccine. But if you've, for some reason, you have 1 or 0, then you are going to have are going to have quarantine restrictions. There's no final decisions there, but we're looking at that. And again, this is because of the growing concerns around a 4th wave, driven by the highly infectious Delta variant. We may well need to continue. It's a principle that we've worked from the very beginning. Keeping our borders safe, limiting the chance for the virus to be introduced in Nova Scotia is a fundamentally important part of our overall COVID response. So we may well need to continue that longer than we thought, at least into the fall, because of this growing concern around a 4th wave.
We'll go to the phone lines now. We have a number of outlets on the phone, so we'll take as many questions as we can in the allotted time that we have for today's availability. We'll start with Alicia Drouse from Global. Go ahead, Alicia.
Thank you. Doctor talked a lot about the importance of people getting vaccinated, so I'm just wondering if from a public health perspective you think that vaccine should be mandatory for public sector workers, specifically, healthcare workers, long-term care workers, and teachers. And if not, why not?
So I think mandatory vaccines has a substantive issues, and I think you got to recognize that ultimately we need to give people some space to make decisions about their health care, and there's so then there's a range of legal and other human rights issues if you label something mandatory. What we need to be thinking about is how do we, if people choose not to get vaccinated, if they're in certain jobs, perhaps, what are the additional measures that they then may be required to take if they choose not to be vaccinated. But I continue to be focused on the vast majority of people. If you give them good information, give them very good access to vaccine, and give them a chance to, if they have questions, to listen to those questions and have a dialogue, I think the vast majority of people, we can get to a point where they're willing to get vaccinated. And I think if you bring in something like as a perceived a coercive approach, then you actually run the risk of actually people who could get vaccinated through a more collaborative approach choosing not to get vaccinated as a response to that coercive approach. So you could actually do more harm than good. So we'll continue our current approach, but we are looking at how we may look at the other certain jobs or roles in our society that if you choose not to be vaccinated, there may be a need for extra precautions and requirements that you have to take.
Go ahead with your follow-up, Alicia.
Thank you. And, we've seen other provinces dropping restrictions sooner than they had originally said they were. And so I just wanted to clarify, is there any chance that Nova Scotia gets to phase 5 and drop these restrictions before reaching that 75%? Like if, say September, October, we're still not there, or is it a hard 75% to get to phase 5? Is there anything, regardless how long that takes?
We've said a minimum of 75. We'd like to go beyond that. We'll always continue to look at where we're at with, vaccine uptake, where we are with, in the near future in terms of where vaccine appointments and where we're likely to get in a short period of time, as well as what our epidemiology is telling us. So we're setting that target. There may be some flexibility around that. I'm never going to paint myself into a corner on anything. I'm always going to say that we have to be able to have some flexibility, but we're saying to Nova Scotians that we need to get at least 75% of you immunized with 2 doses to be able to safely start to lift these restrictions.
Next, we'll go to Stephen Cook from Saltwire. Go ahead, Stephen.
Thank you. Hi, Dr. Strang. I've had some concerns from some readers have written in saying that they're having difficulty seeing their doctors in person as we're phasing from completely virtual care into the doctor seeing more patients in person. And I'm wondering if there's an effort to ensure that GPs are seeing their patients more in person as as the restrictions get eased, or if you know of some doctors that aren't even seeing patients at all in person. Where are we in terms of getting more people in front of their doctors if they need to see them that way?
Yeah, so that's not an issue that's directly under my mandate, but I do know that my colleagues in the department, there's ongoing discussions with Doctors Nova Scotia about the transitioning, again, from the pandemic to endemic and how we actually do things. Virtual care has been a great addition, but how do we make sure we have the right balance between virtual care and in-person care? And those are ongoing discussions within the healthcare system.
Go ahead with your follow-up, Stephen.
And completely unrelated to that, of course, we're already seeing back-to-school sales happening. Students are going to be heading back in a few weeks, and I'm wondering what the school year is going to look like for students. Are there going to be masks required in, say, high school, but not in elementary, or is there a plan in place for students coming back and what their school year is going to look like?
Yeah, we're working with education. We're working with all sectors, quite frankly, in terms of including education, in terms of their sectoral plans about what Phase 5 looks like. So when we're at a place where we're removing restrictions and removing mandatory measures, whether it's a school, a university, various kinds of workplaces, or entertainment, sports facilities, all those things, we're working with them to say, in this, as we get close to the point where we can actually live with COVID, don't have mandatory measures and restrictions, but we want to maintain enhanced measures that prevent the spread of a range of infections. What does that actually look like? So we are working specifically with education on some of those details, and a return to school plan with those specifics will be coming forward in the next couple of weeks.
Next, we'll go to Sarah Smelly from the Canadian Press. Go ahead, Sarah.
Hi there. Dr. Strang, I'm wondering if the numbers coming out of New Brunswick since they lifted all of their restrictions are concerning to you, especially as we saw 13 new cases mostly affecting 20-year-olds today.
Yeah, we're well aware of what's happening in New Brunswick. Specifically, there's a cluster of cases in young unimmunized individuals in the Moncton area. We're watching that very carefully. New Brunswick has, because of those cases in the Moncton area, there's a number of exposure sites, and we're using our own Nova Scotia communication, social media, and other methods to make sure that Nova Scotians who have recently been in Moncton are aware of those potential exposure sites. But we always watch very carefully the epidemiology in other provinces, especially our Atlantic neighbors. So we'll continue to watch that, and we'll take action as appropriate and necessary.
Go ahead with your follow-up, Sarah.
Could you give me an idea of when you say we'll take action as appropriate, can you give me an idea of what kind of action that could entail?
Until we, there's a range of actions as we've done in the past, whether it's advising Nova Scotians not to travel or even restricting travel, increasing our border measures for people coming from New Brunswick. Those are a range of possibilities, but that we have. We'll continue to assess the situation and bring issues or decision points as necessary forward to work with the government to make those final decisions, but we're not there yet. I think we need, New Brunswick is taking very active steps to control their situation. It's not a surprise. It's another example of where we see the Delta variant take hold is when you have under-immunized populations, and quite frankly, it's often in the younger populations, certainly in Canada, where we have insufficient vaccination rates. It's exactly the same population that's having an outbreak in central British Columbia. To me, it emphasizes the message that continue to drive home. All eligible Nova Scotians, 12 and above, we need you to get 2 doses of vaccine and do it as quickly as possible. That is our defense against the Delta variant taking hold here in Nova Scotia.
Next, we'll go to Lindsay Armstrong from the Coast. Go ahead, Lindsay.
Thank you so much for that. I'm wondering if I understand that you're consulting with many parties to get forward with an education plan. Given that school is just a month away, I'm wondering if you can share anything that may already be sort of in motion. Do we know that class sizes will be capped at all? Will there be sort of any things at this stage that have been decided?
Nothing we can bring forward publicly. We continue to work with education on the details of their plan. But I think if parents and people in the education system are looking for indication, we continue to say, as with all sectors, we will be in a place where we'll be removing mandatory measures, removing restrictions. What that exactly looks like in the school setting, we're still working that out.
Go ahead, Lindsay, with your follow-up.
Thank you. On a different topic altogether, I understand that the province isn't tracking reports of changes to people's menstrual cycles that comes with their COVID vaccine. I'm wondering if there's any work that will be done for the province to look at this, perhaps going forward, as this has come up as something that is tied to the COVID vaccine.
That would be under a research protocol. You'd have to do work like that. I'm not aware of any researchers here. There's certainly nobody's come my way with a research proposal. You couldn't do that through routine public health surveillance. It would have to be a very specific research proposal.
Next, we'll go to Megan Groff from Halifax Today. Go ahead, Megan.
Yeah, you've said that the number of our recent cases are related to travel. Do we know roughly what percentage of those cases were from people who were double vaccinated?
We haven't broken down the travel cases, but our overall breakthrough cases, it's well under 1% of our cases have been doubly vaccinated.
Go ahead, Megan, with your follow-up.
Okay, and do we know if two doses of vaccine reduces the probability of long COVID?
Well, 2 doses of vaccine greatly reduces the chance of you getting an infection in the first place. So clearly, it reduces the chance of you then getting a complication like long COVID.
Next, we'll go to Pat Healy, from the Laker. Go ahead, Pat.
All right. This question, Dr. Strang, is Nova Scotia considering giving third doses of the vaccine, like other provinces are, for those who have mixed vaccine status and their vaccine status isn't recognized for international travel?
So I believe there's only one province, Quebec, that's doing that. There's actually no scientific basis for what the decisions other jurisdictions are making around this. I know that the federal government is actively involved in international conversations trying to resolve this issue, that we're focused on delivering first and second doses. You may have heard yesterday the World Health Organization is asking countries to not give third doses of vaccine, countries with robust vaccine programs, simply because we need, there's many parts of the world who have had no vaccine. And so where our focus would be on trying to resolve the issue and not using a third dose of vaccine that's actually not necessary. That vaccine needs to go to other parts of the world who don't have nearly enough vaccine.
Go ahead, Pat, with your follow-up.
And where are talks federally, if you're involved in those, with getting 12 and under vaccinated?
So that's still under the research phase. There's clinical trials going on. My understanding is that it's not likely to be into sometime in the fall until there's enough data from those research trials. How the process works is that the research is done, and that the data from that research is then brought forward to regulators. So in Canada, that would be Health Canada, seeking approval for the vaccine. But as I said, the research is still underway, and as far as I'm aware, there has been no application yet to Health Canada for licensure. It's premature at this point.
Next, we'll go to Steve MacArthur from Radio ABL. Go ahead, Steve. Steve, are you there? We'll go to Shayna Luck from CBC. Go ahead, Shayna.
Hello, Dr. Strang. Wondering about, you're encouraging people to move up their appointments. What are the reasons that people are giving for not moving up their appointments, and what's their strategy to deal with that?
I think some people it's just we're hearing that some people are just they want to get through the summer and then they can deal with a vaccine again, and where there may be some other reasons, but really we're saying to people that we need you all this is about working collectively as a province and all Nova Scotians together. So if we all want to, move to phase 5 as quickly as we can, then we need everybody to get their vaccination as quickly as they can. But even if people are only thinking about themselves individually, they need to understand that, as I said in my remarks, the world is quickly becoming smaller and smaller for those who are not fully vaccinated. So even if you're thinking just about yourself, first of all, you're putting yourself at increased risk if you're not fully vaccinated, and you're probably limiting your opportunities for yourself if you're not fully vaccinated. So there's multiple reasons, but I would hope that people would understand that, like Nova Scotians have done all along, that we do what we need to do to keep each other safe. And right now, the most important thing we can do to keep each other safe is to all get, those of us who are eligible, to get fully vaccinated and do it as soon as possible. Do not wait.
Go ahead, Shayna, with your follow-up.
Thanks for that, Dr. Strang. You mentioned that some of these appointments that are not being rebooked, they stretch into the fall. I'm wondering how far into the fall. So, I mean, for example, if no one changed their booked appointments now, what would be the actual date for phase 5?
We have appointments booked into September and October. So we'll continue to monitor that, and as I said, we've multiple email reminders going out. There'll still be communication. Hopefully, people, we've had a couple of weeks ago, 2 or 3 weeks, we were at, at least it was 70,000 people. Now we're down to 36,000. So lots of people have moved up, but there's still a chunk that we need to continue, and we're asking them now to move their appointment up as soon as they can.
And that's all the time we have for today's availability. Thank you all for joining us.